Director with the Committee to Protect Healthcare. Thank you for joining us today ahead of former President Trump's rally in Wilmington tomorrow. Trump's campaign has said that at the rally he'll be discussing the economy and inflation, but physicians are concerned that he won't address how his policies could raise healthcare costs for their patients and reduce access, and that's why they are speaking out today. I did want to note, we had advised that Dr. Davidson would be joining. She was called into surgery, so she will not be able to join us today, but we are still joined by Dr. Mel and Dr. Sutton, and we're happy to have them here. And a quick disclaimer before we begin, these doctors are speaking as individuals and with the committee today, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves and not include any employment if they do not disclose that. We are recording today's call, so if you would like a copy of the recording after, please send me a chat or send me an email where you RSVP'd, and I will be sure to get that recording to you later this afternoon. Without further ado, I will introduce our first speaker, Dr. Mel.
Hi, my name is Howie Mel. I live in Cornelius. I'm an emergency medicine physician, and I'm here really to look at the threats to healthcare that are happening, that would happen in a second Trump presidency. Donald Trump's been out there all over the place saying that he wants to help Americans with economic relief, but when it comes to health policy, he does the exact opposite. I mean, healthcare is an economic issue. It affects every aspect of what we do. In the emergency department, people are convinced that people are all through the emergency department with things that aren't really emergencies. They're convinced that it's a bunch of people without insurance. They're just tying up the emergencies, and that's why it's so busy. The reality is that our emergency departments are tied up with people who are having real emergencies that were preventable if they would have had access to care. And for example, the Biden-Harris administration has worked tirelessly to lower the cost of insulin, and we're seeing a whole lot less crisis diabetic patients as a result. But if I have a patient who can't get into a primary care doctor because they can't afford it, and their asthma gets out of control, by the time they come to see me in the emergency department, it's a real emergency. But darn it, we could have prevented it a whole lot cheaper and a whole lot easier had we had these folks have access to affordable care. And the reality is that the ACA, the Affordable Care Act, which Trump has tried repeatedly to repeal, has said that he wants to repeal. He wants to replace it with the concept of a plan. It's the cornerstone of what is actually saving people. Every single shift that I work, I have somebody who can't afford their medicine, doesn't have access to care. I'm on the phone begging somebody or other, or I'm trying to figure out what the lowest cost drug is. The reality is that this can't continue. And now Mr. Trump has decided that he wants to steer seniors towards private Medicare Advantage plans. Let me tell you a secret about Medicare Advantage plans. They're not an advantage. Okay. These are plans that they deny, they delay care. I'll have people literally, I will get things back where a plan has asked me as an emergency physician why I didn't do a pre-authorization. That's ridiculous. What do you mean, why I didn't do a pre-authorization? The person came to me in crisis. I only work night shifts. You telling me that at 2 o'clock in the morning, I'm supposed to try and figure out what their plan is and get permission to use the medicine that's going to save their life? Come on, that's just not a thing. I mean, if Donald Trump were serious about helping families with economic relief, he'd work to lower healthcare costs further, not raise them. He'd want to protect the ACA. And with it, the patients in North Carolina, especially those pre-existing conditions, because I don't want to get terribly personal here, but my wife has breast cancer. Okay. Without coverage from our employer, there's not a chance that we would be able to afford it. And to be honest with you, even with good coverage, the amount of money that we're out of pocket each year is insane and wouldn't be affordable if we weren't blessed to the fact that I'm a physician. And we're talking, right now, what we pay out of pocket is over $30,000 each year. It's worth it to me to keep my wife alive, sure. But what about the person that doesn't have that? If we don't find a way to improve access to care, and we don't find a way to make access less, make costs less, we're going to have a problem. And if Mr. Trump's plans move forward, it's going to be a disaster. It's not going to help our health. It's not going to help our financial well-being. He's putting the health of our communities at risk. And honestly, we've got to hold him accountable for that. The only plans that we've seen, the only movement that we've seen recently has been the stuff that Biden and Harris are doing. And that's amazing to me as the guy who was answering the call in the middle of the night. So thank you for your time.
And my name is Dr. Amelia Sutton, and as a maternal fetal medicine physician in Charlotte, I am also deeply concerned about what Donald Trump's vision for healthcare would mean for the health and safety of patients in my community. His agenda would not only make reproductive healthcare more expensive, but also more difficult to access. Former President Trump's push to repeal the Affordable Care Act would eliminate the crucial protections for patients with pre-existing conditions, as Dr. Mel indicated, including pregnancy, and allow insurance companies to charge them higher premiums or even deny them coverage altogether. These protections are essential for ensuring that all patients, regardless of their medical history, can receive the care they need without facing financial ruin. The ACA has made important strides in improving patients' access to affordable contraception as well as maternity care. Thanks to the ACA, my patients can now receive reproductive health care that they need without being burdened by prohibitive costs. And if Donald Trump gets his way, we will return to a time when these essential healthcare services were far more difficult to access and afford. As you know, Mr. Trump has also been a staunch supporter of overturning Roe v. Wade, and he has proudly taken credit for enabling states to impose restrictive abortion bans. These bans are already having devastating effects on patients' health, including a tragic and completely preventable death in our neighboring state of Georgia that has been in the news recently. A 28-year-old mother named Amber Thurman, who was just 6 weeks pregnant, traveled from Georgia to our state of North Carolina to receive pregnancy-ending medication that she could not access in Georgia due to the state's 6-week abortion ban. Unfortunately, a few days later, she experienced a rare complication and sought emergency care at a Georgia hospital. Despite her critical condition, doctors were fearful of legal consequences of interfering, and they waited 20 hours to operate. Tragically, she suffered organ failure and died, leaving behind her 6-year-old son. This heartbreaking case illustrates the real harm caused by abortion bans. In North Carolina, where for now we still have access to reproductive health care, we cannot allow a national Donald Trump abortion ban to rule us here and cause more preventable tragedies. His support for defending organizations like Planned Parenthood would further limit access to reproductive health care, including other healthcare services such as affordable healthcare screenings and STI testings for millions and millions of patients. Reproductive healthcare is a fundamental aspect of overall well-being, and Donald Trump's policies pose a serious threat to access and affordability of these services. As healthcare providers, we all must stand together to protect the rights of our patients and ensure that every patient in North Carolina has the access to the most affordable and comprehensive care that they deserve. Thank you.
Thank you so much, Dr. Sutton and Dr. Mel. Excuse me. We'll now open it up for questions. If you have a question for one or either of the physicians or both, you are welcome to ask that now. You can use the chat function or you can use the Q&A function. And I had a question chatted to me. I'm going to put it in the chat for everyone and I'll read it. Project 2025, written by Trump aides, would repeal the Inflation Reduction Act and the power for Medicare to negotiate drug prices. What would that mean for your patients?
It'd be awful. I mean, point blank. It is absolutely key that we have affordable access to primary care and to basic medications. The emergency department is the wrong place to be doing primary care. And when people don't have access to affordable medications and to affordable primary care, what ends up happening is things that don't need to be emergencies become emergencies. And we see this happen every single shift. I cannot tell you the number of times that I hear, well, I needed to get into my doctor, but I didn't. Or I was waiting until my health insurance for my job kicked in so that I could see a doctor. I have a case very recently of a patient who simply couldn't afford her copays, was suffering with a lot of abdominal pain, but it seemed to be getting better, and then it got worse, and she came into us and she had a ruptured appendix. She is currently in the ICU. She's had to have a colostomy. This is a 21-year-old patient who now will have devastating injuries because she didn't have access to affordable healthcare. She was out of her parents' house, and she was waiting for her healthcare to kick in from the job that she had, and now she's going to, have devastating consequences, to say nothing of devastating medical bills and medical debt, because now she's in the intensive care unit, which certainly is not an inexpensive proposition.
Thank you.
And
Another,
I would echo that as well, is that our patients, when they don't have access to medications because they're not affordable, we're dealing with at least two patients. So that affects both the moms and the babies. And it can lead to lifelong health issues for babies that don't get treated for their maternal health conditions. And in the most extreme cases can lead to death. And so making sure that medications are affordable throughout a patient's lifetime is really, really important to our field as well.
thank you. I'm putting another question in the chat box for everyone to see. This week, JD Vance has floated the idea of grouping chronically ill patients together in insurance pools. How would such a move impact your patients with pre-existing conditions?
The problem is JD Vance doesn't understand economics at all. The whole idea of insurance and the way that insurance works is to spread the risk across the pools, right? The interesting thing about health insurance is that at some point we're all going to need it, right? It's not really insurance, right? Insurance it was designed so that ship captains could get their cargo safely across, and so there was a you could go your entire career if you were a very lucky ship's captain and you could never need your insurance. But everybody is going to need health care. And so the reality is that if you take all the people with pre-existing conditions and you clump them together, right now, the insurance companies are allowed to do that. They're allowed to charge triple what for people with high risk things what a non-risk person has. But that's the limit. That's the hard limit, right? You cannot charge more than triple. Would triple, by the way, which is not enough. It should be less, but bygones, we allow them to charge triple. What JD Vance is proposing is we lump these folks all together. It will effectively block pre-existing conditions, because what will happen is that the health insurance will become absolutely unaffordable, because an insurance company can't exist if all they're doing is paying out, right? If everybody pays an insurance company $10,000 and every single person uses $15,000 worth of health care, well, guess what? That insurance company is going under. So unless you have a bunch of people who are paying $10,000 who aren't using $15,000 worth of health care, that thing doesn't work. And so the way that it works for us, and the way that it's structured in our country, is you draw the risk pools together, right? And so that way we know that, yes, when I'm 25 years old and I'm just starting out and I'm a brand new, whatever I am, and I'm paying into insurance, and let's face facts, I'm a guy, I'm probably not going to go to the doctor when I'm 25, but I'm paying into that healthcare plan, knowing that I'm really covering the 45, the 65, the 85-year-old, and counting on the fact that when I become that 45, 65, 85-year-old, there'll be a 25-year-old paying for me. Now, what JD Vance wants to do is say, well, hey, we're just going to keep those 25-year-olds over here. It doesn't work. It just doesn't work. I mean, you don't understand basic economics, which is unfortunately a very scary realization that most of Trump and Vance's ideas go against basic economics.
Thank you. I've gotten one more question so far. Trump and Vance have both indicated support in the past for a national abortion ban, but also claimed lately they would actually leave abortion laws up to the states. How do you think they would actually govern on abortion?
Well, I think their track record is very clear that they, first of all, Trump has taken credit for Roe v. Wade being overturned. And the whole idea of putting it back to the states, of course, then resulted in multiple trigger bans, which are incredibly restrictive, as we all know. Vance has been quoted recently saying that he would support a quote unquote federal response to actually restricting women from traveling across state lines from a state that had a restrictive abortion ban in place to one that does not. So that speaks to really an underpinning of desiring a more national abortion ban. So I think that all of the evidence points to their desire to have a national abortion ban or other laws that may restrict women from traveling between states, which in effect is a national abortion ban. This is devastating. This will result in more maternal deaths like Amber Thurman across the country if such a ban were in place or if there were more restrictions imposed. This is something that we cannot stand for.
One of the things in the history of emergency medicine that gets almost a dark chapter is that pre-Roe v. Wade, when I've talked to my mentors, they would talk about the sepsis ward. And the sepsis ward was where all these women were that were septic. And what the dirty little secret of the sepsis ward was it was the post-abortion ward. It was what was happening when women were forced to seek abortions in manners that were very unsafe and very dangerous to them, to their lives, to their livelihoods. And they would all end up in emergency rooms. And it was so bad in some places and at some times that there would be 3, 4, 5 women at a time being cared for in the emergency department, because at that time you weren't hospitalized unless you had a primary care doctor, and many of these women wouldn't acknowledge to their own doctors that they had had the abortion, so they would end up in an emergency room being cared for by an intern who was desperately trying to keep them alive when they had perforated uteruses and perforated bowels from all these abortions. Don't let anybody fool you into thinking that an abortion ban will stop abortions. What it will stop is safe abortions. What it will stop is actual health care. And it will force women in the most desperate times and under the most desperate decisions to do things that they feel they have to and expose themselves to horrifying danger. And there will be deaths, and there will be a lot of deaths, and there will be a lot of disability. There will be a lot of women who will lose their fertility. No one makes a choice to abort a baby lightly. This isn't birth control. This is hardship. This is agony of decisions. I've watched it. I've seen these women come in. It's awful, and no one is doing it lightly and glibly the way that Vance and Trump seem to think it is, or God forbid Robinson. We can't go back. We can't go back. I don't want to run a sepsis ward. I want Dr. Sutton to be able to provide the healthcare to patients. I want to be able to provide healthcare to my patients. And to be honest with you, I went to school for a long time. So did Dr. Sutton. I don't want somebody who hasn't to be making decisions about what should and shouldn't happen for me and for my patients.
Absolutely. Thank you, Dr. Mill and Dr. Sutton. And I am not seeing any more questions, so we will go ahead and conclude today's call. Thank you so much, media who are able to attend. I know it's a busy day and appreciate your time. And thank you so much, Dr. Sutton and Dr. Mill, for your time and your advocacy on behalf of your patients. We really appreciate it.
Thank you so much.
All right.
Thank
Thank you,
you.
everyone.